I was a member of the search committee that was charged to find a new chancellor for the Duke Health System. We zeroed in on Dr. Dzau because he combined the ability to be a physician, which he's first, with being a leader in leading a $2 billion plus health system. And at the same time, he had a global approach. He's a global leader who has perspectives as to the healthcare systems around the world that he used to strengthen the Duke Health System.
He is an intense, high-energy guy who is always looking at new ways to pursue excellence, trying to find new models, trying different things, looking for partnerships, looking for ways that he can change the traditional paradigm of how healthcare is delivered.
His commitment to improve patient care and safety in this environment led to Duke providing the excellent patient care and most safe environment that it could in a time when other academic medical centers were scaling back.
Here in this cancer center, we've seen a lot of new technology, cutting-edge technology, and it gives me comfort to know that every patient that comes in gets quality care.
Dr. Dzau's been doing this for a very long time, and he's a very bright guy, so he knows straight away when there's a problem or there's an issue. And I think one of the things that we have in science is that we can sometimes get kind of lost in our kind of little ivory towers, and he really does focus us back down onto what is the main thing, is basically treating people. And that's always been a big concern of his, and that really does motivate us.
So Duke is clearly an international leader in biomedical research, generally in cardiovascular research specifically, and that's due to a significant extent to Dr. Dzau's leadership and presence here at Duke.
Dr. Dzau was really instrumental with the building of the new Cancer Center and Duke Medicine Pavilion, which have really changed the landscape of our healthcare footprint.
I think Dr. Dzau is one of the most committed, hard-working people with whom I have ever worked. He's a man of uncommon vision, both in education and in healthcare, and his commitment to a global agenda is one that I think he'll advance very effectively at the Institute of Medicine.
Many people like me who have identified that they want to be hospital leaders have a hard time when they're early in their career finding opportunities to kind of develop that skill set as they learn to be doctors. And so he came up with this program where it allows people to basically pursue residency and learn to be good doctors and also get exposure to being healthcare administrators. So his vision has directly impacted me, and I'm grateful for everything that he's done because without that program, I definitely wouldn't be where I am right now.
Victor and his wife Ruth have embedded themselves in the city of Durham so well that when you think of Duke University Hospital, you almost think about Dr. Dzau. Durham is known as the city of medicine, striving to be the city of health. Victor, in my opinion, has led that effort and continues to lead that effort in a very demonstrative way, as well as being involved.
So I think the way in which you can best characterize Victor's input and impact on global health is that he's been very involved in cross-fertilization of ideas and people between different institutions, different parts of the world, and helping them come together to come up with solutions for improving the health on a global basis.
Well, I think the impact that Victor's had here at Duke has been very much not just changing the organization here, but making us much more present and active around the world. Part of that's been through his mentorship here. Part of that has been in facilitating the growth of our international activities like the Duke NUS Graduate Medical School in Singapore, where we have now lots of students and trainees that reflect the ability to bring a US type of medical education and training to other parts of the world.
The Duke Institute of Health Innovation is a reasonably and relatively new initiative within Duke, but it's an extremely important one. Duke will be at the cutting edge of health innovation in the United States and in the world, and I think all of this is because of Victor's vision and commitment and leadership. in this area.
We feel so fortunate at the Institute of Medicine to have someone of Dr. Dzau's intelligence, experience, expertise in health, and personality to lead the organization in the next phase of our work. So many problems need attention to improve America's health. We're very fortunate to have Dr. Dzau at the helm.
Part of building a great team is allowing it to do amazing things, and he's done that. As a result, incredible things have happened, and he'll always be a part of the Duke Medicine family. In fact, he'll be a part of the Duke family and our Duke basketball family forever too, because he sat in that end zone and gave us support every game.
The trustees, in reviewing extensively the requirements and the candidates, really came up with the right guy at the right time. He's left a legacy that builds on a great tradition at Duke Medicine and has enhanced the Duke brand considerably in doing so.
Outside of Victor's new office, there's a statue of Albert Einstein, and that's an appropriate symbol of great scientific research and great brilliance. Victor brings great scientific research and brilliance to the task that he has ahead of him. I wish him the best and hope he'll always remember that he's part of the Duke family.